hearing outside of Washington, D.C. in decades. The federally appointed committee is seeking input on how to adjust dietary guidelines which have been in place since the 1980s. I'm Craig Cohen. Today on Houston Matters, what the committee may be considering and what Houstonians may have to offer. Nutritional guidelines may be getting a makeover. The Dietary Guidelines Advisory Committee is holding a public hearing today and Thursday here in Houston. It's the first time the committee has held such a public hearing outside of Washington, D.C. in decades. And its members want feedback on revisions to decades-old recommendations about what constitutes proper diet. Dr. Nadir Ali is the former chairman of the Department of Cardiology at HCA Healthcare Clear Lake. He's the program director of Low Carb Houston. That's an annual conference at UH Clear Lake, and he plans to recommend a low-carb diet to the committee this week. Dr. Ali, good morning.
Good morning.
What's wrong with the current nutritional guidelines as they currently exist?
So I've been a practicing cardiologist for about 30 years, and for the first 24 of those, I generally followed a traditional view. I recommended the standard American diet, healthy whole grains, fruits. And I felt that my patients had a moral character that did not permit them to reduce their calories. And I could not have been more wrong. Americans have very good moral aptitude. And I saw patients suffering from diabetes, heart disease, obesity. And in 2013, I had a transformation. I myself needed to lose about 25 pounds. I was about 180 pounds, and I could not keep up with my cycling team. I am a team doctor for a racing team. And that's when I came across the concept of low-carb diet. And I was surprised that in a span of a few months, about 4 months, I was able to lose 25 pounds. I was down to about 155. My cycling improved. And I said, if this is so easy for me to practice, why should I not try it on my patients?
How does a low-carb diet help a person's cardiovascular health specifically?
So I think that one of the major reasons why we have obesity and diabetes is because we have a condition called high insulin states, hyperinsulinemia. And that is driven primarily by an emphasis on carbohydrates. Our body is not designed to handle so much carbohydrates because our pancreas is not geared to work with them. Our ancestral diet never consisted of such a large load of sugar and sugar-like substances. And if you look at the incidence of diabetes in the United States, or if you expand that and consider hyperinsulinemia, that means high insulin levels, almost 2/3 of people in this country would be considered to be hyperinsulinemic. If you just consider diabetes and pre-diabetes, it would be almost about 50%. Another way to kind of explain this is that if the body is given carbohydrates to burn and fat to burn, it will almost always choose carbohydrates to burn first because we have no mechanisms to store a large amount of carbs. We can store only about 100 grams in our liver. And so a person who is carb dependent is unable to burn fat. The fat gets locked in, especially when insulin levels are high. And I think that is one of the basic biochemical abnormalities that the low carb committee and the LCAN, which is one of the committees I work for, and the scientific people behind it are trying to correct.
Dr. Nadir Ali is the former chairman of the Department of Cardiology at HCA Healthcare Clear Lake. He's the program director of Low Carb Houston. Dr. Ali, thank you very much.
Thank you.
And joining us now is Dr. Tracy Ledoux. She's an assistant professor in the Department of Health and Human Performance at the University of Houston. Dr. Ledoux, welcome to Houston Matters.
Hello, welcome. Thank you.
The committee that we're talking about, this federally appointed committee, they once promoted limiting egg consumption, then reversed that position. The committee used to promote several servings of grain each day. That is not the conventional wisdom now. Why does it matter what this committee recommends?
So that's a great question. The dietary guidelines for Americans are for the target audience is actually for health professionals and for policymakers. And so it's a tool available to policymakers that oversee federal nutrition programs to help them decide what foods to offer and how much. Things like the National School Lunch Program or the WIC program, which offers supplemental foods to women, infant, and children. It's also a tool for health professionals. And so the goal is that the dietary guidelines for Americans offer recommendations for the average healthy American to achieve optimal health by making sure they get in all of their vitamin needs, mineral needs, fiber, macronutrient needs within the foods that they're eating. And it's for health professionals to then take those basic guidelines and adapt them to the patients that they're working with.
Does whatever this committee recommends also find its way eventually into schools and health classes? I think back to when I was in school and they taught us the food pyramid that is hopelessly out of date now.
Yes, no, it certainly does. And like I mentioned, the school lunch program, the National School Lunch Program, bases its menus off of the dietary guidelines for Americans. So it certainly will translate to federal programs, also the military and prisons and, these larger institutions.
Dr. Ali intends to talk to the committee about low-carb diets. Should low-carb diets be promoted for everyone?
Well, I have a hard time saying one diet approach for everyone. Most of the research has shown that when you provide people with a diet that they can stick to, the diet that they can stick to varies. So some people are able to adhere to a vegetarian diet for many years and maintain a very healthy lifestyle that way. Others it may be a low carb diet. So it's difficult to say which exact approach is right for each individual person. There are a lot of different factors that go into that: preference, culture, environment, lifestyle, and it has to be adapted for everybody.
What are some good resources to determine the best diet for your personal health?
Well, there are some evidence-based approaches that dietary patterns, I would call them, that promote health and can help patients lose weight or individuals lose weight if they're looking for that. So low carb would be one approach if that's what they enjoy and that's what they can stick to. A Mediterranean diet would be another appropriate diet for somebody to follow. The DASH diet is another.
And what is the DASH diet?
So the DASH diet is something that the National Heart, Lung, and Blood Institute, I believe, came up with years ago based on research for hypertension. Essentially, it looks a lot like the Mediterranean diet. It promotes fruits and vegetables, whole grains, nuts, but it also has an emphasis on low-fat dairy products, with the original goal being to help blood pressure, hypertension, but it has also been shown to be beneficial for weight loss and helping to maintain a healthy weight.
If it's hard to come up with a one-size-fits-all diet for everyone, what would you like to see this committee ultimately come up with?
Well, I think, like I said before, this committee is not charged with coming up with a one-size-fits-all diet approach for everybody. It's charged with coming up with a dietary pattern that would help promote health among healthy Americans, that allows them to meet their vitamins, minerals, fiber, their basic nutritional needs.
So we start with this sort of baseline of, okay, if you're healthy to begin with, then what do you need to maintain that health?
Yes.
And that's different from what you would recommend for somebody that is dealing with some sort of
cardiovascular disease, cancer, hypertension, blood pressure, diabetes, etc.
Each one
chronic
of those
diseases
really require a different dietary approach.
Right. And in terms of obesity, which is, I think, what is on everybody's minds, it's a multifaceted, complex issue. So diet is certainly one important factor, but so is physical activity, so is appetite, so is sleep, so are genetics, so are environment, socioeconomic conditions. So there are a lot of things that go into our health status.
Dr. Tracy Ledoux is an assistant professor in the Department of Health and Human Performance at the University of Houston. Dr. Ledoux, thank you very much.
Thank you.